So I would like to show you an example of a nodular melanoma here. So you can see at this power, there appears to be somewhat of an ulceration to the upper right-hand side and then some reactive healing epidermis to the left with this very nodular proliferation of some type of neoplasm. It almost has like an eosinophilic cytoplasm to it. It's composed of multiple epithelioid cells that appear to be trying to nest, but not doing a very good job of it. Mostly a sheet-like pattern of growth, pretty wall-to-wall here of atypical epithelioid cells. You can notice the very prominent nucleoli among the cells. There's scattered pigment in between some of them and scattered mitotic figures as well. So overall, this is consistent with a nodular melanoma. It does have a predominantly vertical growth phase, and it's measured to be at 6 millimeters Breslow depth, and that's based on just the base of the ulcer. Just to scroll around to show you how pleomorphic these cells are. Atypical mitotic figures, scattered pigment. And I wanted to bring your attention to just how eosinophilic the cytoplasm can be in some of these melanomas. So definitely want to do confirmation stains to make sure that this truly is a melanoma. And so stains were performed on this, and it's a diffusely SOX10 positive. I'll show you an example of that really quick. You can see the neoplasm is diffusely positive for SOX10. SOX10 is a nuclear stain. It can also mark neural derived cells. So it's important to do another melanocytic stain just to be safe. And a melan-A was performed on this, and it was diffusely positive as well. HMB was also performed. So this is the HMB, or human melanoma black 45 stain. Typically, HMB is only expressed normally in junctional melanocytes, but is heavily expressed in malignant melanoma cells that extend down deep into the dermis. And so this tumor is diffusely positive for HMB45. So that's highly supportive of a melanoma too. If you did a PRAME stain on this, I'd be willing to bet that it would be diffusely positive, since PRAME has a high sensitivity and specificity for melanoma when compared to benign melanocytic lesions. And that is an example of a nodular melanoma. Now, one other thing I will point out is if you were being a purist, you'd want to say that a nodular melanoma does not have a significant junctional component. There does appear to be some areas here of junctional proliferation of melanocytes. So whether or not this started out as a superficial spreading that rapidly developed a nodular component, that could be considered. But for all intents and purposes, the most important thing here is going to be that the Breslow depth appears to be 6 millimeters. So it puts it well beyond stage 4, and this patient would be getting a sentinel node.